The first time I went to sub-Saharan Africa was when I took an extended trip there as president in 1998. I went to South Africa and Tanzania and Mozambique and Rwanda and Senegal. It was the longest trip and most extensive one any American president had ever taken. I saw people working to turn the tide of AIDS. I saw people in South Africa working to make their then still new democracy a benefit to all the people there. I saw the people in Mozambique trying to overcome the impacts of a terrible natural disaster which had stopped what was one of the fastest growing economies in the world, and I saw them overcome it. I saw the people in Tanzania trying to put together their country. I saw in Senegal the soldiers in Western Africa drilling with Americans, learning to do peacekeeping so they wouldn't have some of the horrible things that happened in Sierra Leone and other places, and the fights over blood diamonds, ethnic conflicts. I was in the villages on the edge of deserts, seeing women drilling wells and starting new businesses with microcredit loans. And I went to see the place where the slaves were sent from West Africa to America. It was an interesting trip. I saw the most populous country in sub-Saharan Africa, Nigeria, and I had a very moving encounter there with the then president, Mr. Obasanjo, because together we called people who were HIV positive up on a stage on national television, and he embraced them for the first time, and no one had ever seen an African politician do that at the time. I believe Africa is full of countries with enormous promise, and I like trying to help people reach their promise. We started with the HIV/AIDS work, and what we were doing in the beginning was basically getting the world's least expensive, high-quality medicine, diagnostics, testing. And then we did that with pediatric AIDS medicine, dropped the price from roughly $600 a child a year to $60, and now 2/3 of all the kids in developing countries in the world are getting this medicine. Then, thanks to the Gates Foundation, we did it with malaria medicine. Then we started actually helping to build systems and trying to change cultures. In Lesotho, we helped not only rebuild a hospital, but support the government's desire to have everybody 12 or over tested so we could really do some prevention and people could get rid of the stigma. In Ethiopia, we've had as many as 120 or 30 people working trying to build out thousands of clinics in rural areas in Ethiopia, because the urban centers are well staffed, but roughly 58 million of the 80 million Ethiopians live in 60,000 or more villages of fewer than 1,000 people. In Malawi and Rwanda, we started trying to do some of the same efficiency things with agriculture we did with healthcare, as well as to plant trees and do a number of other things. And then I got involved in this energy work and in big cities all around the world, and Lagos, Nigeria is one of the cities we work in, and I have offered our services to others to help retrofit buildings and close landfills and turn them into energy sources. They're sources of wealth for mega cities and poor countries throughout the world. So I stay busy in Africa. I love it. In addition to the work that my foundation is doing, I want to get some sense of how the countries that I'll be visiting are doing generally. You know, I want to go back to the townships and see how they're doing. I'm always learning, always growing when I'm there. It's been an honor to work there.